I'm going to talk today about a study that I just completed looking at day-to-day associations between sleep and socioecological stressors in family context. So we know that insufficient sleep, which is about less than 7 hours per night, is a leading determinant of death and disease that's disproportionately represented in low socioeconomic status groups, and it's a driver of health disparities. We know that lifelong sleep behaviors are established in toddlerhood and are concordant with caregiver sleep. And while interventions to improve bedtime quality, such as caregiver stress management and bedtime routines, have successfully improved early childhood sleep health and higher SES context, there's no such evidence base for low SES families. And caregivers in low SES families may struggle to provide consistent and nurturing sleep routines due to unmodifiable socioecological stressors, such as non-standard work schedules, housing instability, lack of family support, etc. So how caregivers cope and emotionally respond to such stressors may be more amenable to intervention compared to the socioecological stressors. And with improvement, they may positively affect caregiver and toddler sleep. What we don't know is how the day-to-day variability between caregiver stress management, so like coping skills, emotional response to daily stressors, and caregiver toddler sleep health, how they relate and vary in a real life setting. So this study aimed to ascertain the day-to-day variability between caregiver experience and management of socioecological stressors, caregiver stress management and caregiver and toddler sleep health, and caregiver and toddler sleep health and caregiver stress management in socioecologically disadvantaged families. We recruited caregiver and toddler dyads through social media postings and then physical flyer postings in Delaware, Maryland, and Pennsylvania. Toddlers had to be 1 to 3 years of age. Moms had to be greater than 18. And families had to be eligible for federally funded programs. That was kind of our SES proxy. Oops, sorry. And we were able to enroll 69 caregiver toddler dyads, which was really incredible. We measured sleep through actigraphy, which is like an accelerometer that moms wore on their wrist, toddlers wore around their waist or their ankle. And they wore those for 2 weeks, 24/7. And then additionally, mom kept a daily diary through RedCap about sleep, bedtime routine, bedtime quality, and also stressors. So every day moms would report, and I'm saying moms because as I show you in the next slide, 90% of the sample was moms, but it was open to all caregivers. But moms reported on experienced stressors that they had during the day, how severe that stress was on a Likert scale, how they managed the stress. And so that was free text response. And then again, on a Likert scale, how effective were those stress management strategies. And then for data analysis, we quantified the reported daily stressors, which was a free text response, their severity, management strategies, and effectiveness. And then we did qualitative content analysis to assess mothers' overall experience with stress. And then we used generalized linear models to quantify those day-to-day associations between stress and sleep. So as you can see, about 50% of toddlers were male, 60% were Black. As I said, 90% were mothers, about 40% were single, a quarter had less than a high school education, and 70% were receiving public insurance. In terms of sleep, we found that toddlers on average were going to bed around 10:15, which is late. It's the recommended bedtime for toddlers is around 9 o'clock at the latest. And then they were only getting about 9 hours of sleep, which again, national recommendations are 11 to 14 hours of sleep. And so, they were not meeting those. And this was 24-hour sleep. So this is accounting for naps as well. And then their sleep efficiency was 90%. Sleep efficiency is the amount of percentage of time that you're actually asleep when you're in bed. So that was actually, a decent number. So the quality of sleep appears to be decent. Caregivers, also a late bedtime. We're getting on average close to 7 hours, which is recommended for adults, 7 to 9 hours of sleep per night. Their sleep efficiency was around 82%, which is the recommendation is 85% or more. So they were just below that mark. And then we looked at correlations between caregiver and toddler sleep and found that, which makes sense, these metrics were correlated among the caregiver and the toddler. So, they were going to bed around the same time, sleep time was correlated. So, that's what we would expect. In terms of stress, a quarter of the caregivers reported family and parenting issues as their primary stressor. They also reported daily stress as moderate to high. 90% of caregivers took a healthy action against stress. And you can see here is a kind of classification of the type of actions that they took. So many reported like mindfulness-based techniques, such as like breathing, guided imagery, those types of things. Others did distraction, self-care, movement, alone time, and very few reported substance use as a coping mechanism. And then about 45% reported these healthy strategies as not effective in managing their stress. So what we found was that, from the qualitative content analysis, was that mothering itself did not appear to be the driver of stress. It was more so having to mother in disadvantaged contexts where mothers were faced with structural barriers that are out of their control, such as low paying, high demand jobs, patriarchal values that contribute to entitlement and lack of support from their partners, et cetera. And the disadvantaged context in which these mothers have to mother is what is stressing them out daily. So that was kind of the overarching conclusion from all of that qualitative data that we got from those daily diaries over 2 weeks. In terms of the quantitative findings from the mixed models, we at this point have only really looked at adult data, and we're currently looking at the toddler data. So maybe when I have that data, I'll come back. But for adults, we found that in terms of looking at the stress to sleep relationship, we found that their sleep efficiency, so again, that's how much they're sleeping when they're in bed, kind of a quality of sleep metric, varied by how effective their stress management strategies were. So they had worse sleep efficiency when the strategies were ineffective and better sleep efficiency when the strategies were reported as effective. And then on days when caregivers reported high stress management effectiveness, their sleep duration increased by 48 minutes. And so that's pretty significant. And then in terms of sleep to stress, we found that for each additional hour that a caregiver slept, they had 1.2 odds of implementing a healthy action in response to stress that following day. Then we also found, and this was a kind of questionable finding, didn't really make sense, but found that each additional hour that the caregiver stayed awake, they had a 1.2 increased odds of successfully managing the stress the next day. And so how we kind of interpreted that was perhaps, in that extra hour that they were staying awake, maybe it was after they had put the child to bed. And so they were taking that time, that opportunity to actually enact those healthy coping strategies, which made it easier to react to the stress the following day. Kind of how we interpreted that. So in conclusion, as I said, we are finding that these caregivers, these mothers, primarily mothers, are stressed. They're employing healthy coping strategies, but they're not working. Our findings underscore the importance of perceived stress management effectiveness on sleep quality and quantity in low SES contexts. And future work is needed to better understand how mothers are employing these strategies and if targeting such strategies may be effective in improving their sleep. And really overarching conclusion is that structural change is needed in our society. We need to better support and care for disadvantaged families, which I'm sure you all would agree with. Want to thank my incredible study team and my funding, which was the pilot award through Excel, which was really incredible to be able to get this work done. References, and I'm open to taking any questions, and I will go ahead and stop sharing.